Hi, this is Dr. Christy DeSabry, founding physician of Bone and Body Women's Health. 'Tis the season for education. Yesterday, I gave a lecture to the National Bone Echo, which is a program for clinicians of all levels to learn more on bone health and how to take better care of women and men with osteoporosis and prevent fractures. The topic yesterday was one close to my heart. As you know, I always take care of reproductive and post-reproductive age women, and the topic was, does contraceptives affect bone health? So I reviewed all the literature. There's a meta-analysis, systematic reviews, a couple of months of work went into this lecture. And I really wanted to distill it because this is such a common question when I see women of reproductive age and we use contraceptives. So the evidence really in a nutshell is when we look at combined oral contraceptives, things like oral contraceptive pills or the patch or the ring, that there's very little difference in any bone mineral density effect or reduction of fracture in women who are average weight, who are cycling regularly, and who are on these contraceptives for, again, contraceptive or other non-contraceptive benefits like things controlling headaches, controlling endometriosis, acne, premenstrual dysphoric disorder, mood conditions, many reasons why women are on contraceptives beyond the contraception benefit. I also reviewed the literature for IUDs. This is such a common use now for our teens and many women all across the lifespan, even into their 40s and 50s. And again, with the progestogen-containing IUDs, primarily levonorgestrel IUDs, there seems to be no difference in effect of bone mineral density. There's no reduction or of fractures, and there's also no increase in fractures with use of progestogen-only devices. When we think about other things like Depo-Provera, which comes in an IM or intramuscular or subcutaneous option, we know that there is some bone loss associated with this option. This is a highly effective contraceptive for many women. If you are of the extremes in the reproductive cycle, so early in the menarche or closer to perimenopause, we know that there might be some bone loss. Most of that bone loss is able to be regained unless, again, you're very close to menopause, in which we know that the BMD or the bone mineral density is on the decline. So in net, when we look at oral contraceptives or combined oral contraceptives, there seems to be no significant BMD or bone mineral density increase. However, when we look at perimenopausal women close to the menopause transition of normal body weight, there might be some benefit in higher doses of oral contraceptives in those women, both in increasing bone mineral density and decreasing something we call bone turnover markers in the literature. We know when we look at IUDs, there's really no significant difference. Also, the implants, the contraceptive implants, no significant difference in bone mineral density. This is not affecting or increasing your risk for a fracture. When we think about things like Depo-Provera, medroxyprogesterone acetate, IM, or subcutaneous, this might affect bone mineral density, so you want to be very cognizant about calcium, vitamin D, exercise, and the length of time of use of this contraceptive. So I hope this has been helpful. It's distilled an hour lecture into a couple minutes here. But important to know this literature when you're evaluating contraceptives and then just asking the questions when you are on them. Hope to see you soon.